Today's discussion is about infected ingrown toenails. The medical term for this condition is known as a paronychia. Infected ingrown nails are generally the result of a nail piercing the surrounding flesh with bacteria getting into the opening and then becoming infected. Less commonly, the cause can be from trauma to the nail, such as dropping something on the toe, or a condition that I refer to as microtrauma, which is repeated pressure against the nail, which might be seen in someone who plays soccer or tennis where the toe is constantly being jammed into the end of the athletic shoe. Another cause of a paronychia can be the result of poor cutting techniques on the part of the patient when trimming their own nails. I have also had patients come to me over the years with infected ingrown nails as a result of going to nail salons where the pedicurist attempted to cut down the side of an ingrown nail, only to see it get infected. Infected ingrown nails are a bacterial infection which needs medical attention. Aside from the pain factor, if left alone, the infection can spread. Generally, in a healthy individual, you will see a reactive cellulitis, which is redness in the immediate surrounding area. You may also see pus coming from the area as well. However, in a diabetic patient or a person with poor circulation or other debilitating illnesses, the infection can spread and you can end up seeing what we call an ascending cellulitis, meaning the redness travels up the foot, even into the lower leg. Tissue in the infected site may begin to break down, leading to ulceration or gangrene, which depends on how bad the circulation to the toe actually is. In other instances, an untreated ingrown toenail, the bacteria may invade the adjacent bone, leading to a bone infection known as osteomyelitis. As you can imagine, a bone infection is a very serious problem and may require surgical removal of the infected bone. If you present to the doctor's office with a long-standing infected ingrown nail, your doctor may order an X-ray to rule out osteomyelitis. It has been my experience that rarely a paronychia clears up on its own, although it can happen. Most likely the portion of ingrown toenail will have to be removed. Many times this can be done without local anesthesia, but sometimes the toe does have to be put to sleep in order to remove the offending nail. If a patient comes to the office with a first-time problem, I generally just remove the ingrown nail with the understanding that the piece of nail that was removed will grow back. However, if a patient develops a recurring problem, I then generally recommend an office procedure whereby the offending piece of nail is removed on a permanent basis. It is important to note that only the ingrown portion of nail, not the whole nail, needs to be removed. General treatment for an infected ingrown toenail will require both an antibiotic and a partial nail removal, as an antibiotic alone in most cases will not work. If a patient is just on an oral antibiotic, the toe will appear to improve initially. But once they finish with the antibiotic, the toe will worsen again. Once again, if the nail is piercing the flesh, it is almost always going to reinfect unless it is removed. So what should you do before seeing the doctor should you develop a paronychia or even just a painful ingrown nail? The best thing you can do initially until you seek treatment is to soak the foot in a solution of table salt or Epsom salt, using 1 tablespoon per quarter of warm water, not hot water, for 15 to 20 minutes. Do this 2 to 3 times per day. If the solution burns, then reduce the amount of salt. After soaking, apply an antibiotic ointment and dressing. Not only will the ointment help the infection, but it will soften the surrounding skin, making the toe less painful. Do this repeatedly until you receive professional care. If you are diabetic or have compromised circulation, seeking immediate medical care is mandatory. Sometimes patients will present with a paronychia that has a bright red growth adjacent to it. This is called a granuloma. It is an accumulation of blood cells, bacteria, and scar tissue. In itself is nothing serious other than it tends to bleed a lot if traumatized. When the ingrown nail is removed, we generally cauterize the granuloma. However, there is a word of caution. If the granuloma keeps coming back with or without an ingrown nail, it should be removed and biopsied. In very rare instances, these granulomas may actually be what's known as an amylonotic melanoma, which is a very serious skin condition. They require immediate medical attention. So how do we prevent ingrown nails? Unfortunately, there are some nails that are just predisposed constantly ingrowing. Examples would include nails that have been subjected to trauma, nails that have fungus underneath them, which forces the center of the nail upwards while causing the sides of the nails to grow into the flesh. Abnormally shaped medial lateral nail folds may also predispose nails to grow in and become painful. Lastly, nails that are very thin and hard, which makes them very sharp, will tend to cause ingrown nails. Things you can do to reduce the chances of ingrown nails. Stay away from nail salons. In general, the pedicurists think they are amateur foot doctors and they try cutting out ingrown nails, usually ending up creating infections. When cutting your nails, use a sharp instrument instead of trying to pick the nail, which ends up leaving rough edges, particularly on the side of the nail. We see this a lot in children. Wear shoes with a wide toe box and lower heel in order to not force your toes into the end of the shoes. Believe it or not, sometimes foot structure can aggravate an ingrown nail. An example would be a bunion deformity, which might aggravate the nail on the inside of the nail. In some cases, the bunion may have to be corrected in order to alleviate growth of chronic ingrown nail pain. Nail fungus may exacerbate ingrown nail pain, so clearing up nail fungus can help relieve the pain associated with ingrown nails. If you have any concerns or questions and have recurring infected nails with or without infections, a visit to a local podiatrist would be in order.